Good morning and good afternoon, everyone. My name is Lana Davis. I use she, her pronouns, and I work at Futures Without Violence. And I'm one of the panelists for this webinar today, Lessons Learned About Survivor-Centered Support During the COVID-19 Pandemic. Before we get started, and as people are, slowly sort of rolling in, we wanted to acknowledge the mass shooting yesterday in Uvalde, Texas, on the heels of another mass shooting in Buffalo, New York, just 10 days ago. Our hearts, our collective hearts, are with the entire community. Communities, and to all of you who are parents or teachers, we have extra love for all of you. It's hard for us as violence prevention activists and practitioners to not feel sort of the loss of our humanity in moments like this. And it's really important that we not only take care of ourselves and practice resilience so we can do the work that we are all here to do, but also to be kind to ourselves and to each other. So we wanted to acknowledge all of the emotions that people are having. And maybe we could take, 1-2 minutes to remember all of the people who are hurting and to take a collective breath together to ground us as much as we can be so we can have this conversation today. So thank you, and sending love to all of you.
Thank you so much, Lana, for grounding us in this session before we get started. Much appreciated. Good morning, excuse me. Good morning and good afternoon, everybody, wherever you're at in the world. My name is Jennifer Haddad Bell. I'm a program consultant here at Futures Without Violence. I use she, her pronouns, and I work with the health team here at Futures. I just want to make a few reminders before we get started. One very important reminder that this webinar is being recorded, and you will be receiving the slides, the recording, and any resources that our amazing presenters are going to be sharing. You'll receive all of that by email and also be archived up on the Futures Without Violence website. It usually takes a few days, but you will be getting everything that we're sharing today. Lastly, you can use the chat feature today, and we also have the Q&A feature. If you have any questions that you want to bring to the presenters today, that is available to you. And I also just want to make a quick reminder that at the end of this webinar, as soon as it closes, there will be a very, very brief evaluation that will pop up on your screen. It will just take a few minutes. If you're able to complete that for us, it's very appreciated and really helps us to create more webinars and trainings for you all and improve what we're doing. So we appreciate that. A little bit about Futures Without Violence, if you're not so familiar with us. We're a health and justice nonprofit. We're located up in the San Francisco Bay Area of California, and our mission is to support healing for those traumatized by violence and abuse and to create healthy families and communities that are free of violence. We are a federally designated National Health Resource Center on DV. We call it the HRC. And the HRC provides training, tools, resources, patient ed, and technical assistance for programs all around the country. And the health team in particular focuses on promoting and advancing prevention and health equity, quality healthcare, and support services for survivors of all ages, as well as their families. We also are involved in policy advocacy efforts, and we work to excuse me, develop and share strategies and promising practices and frameworks that help folks around the country do work at the intersection of health and intimate partner violence. So today's conversation is really important, and it is the last part of a 3-part series that we've been doing the last few months, helping us to discuss and address some of the most pressing issues and lessons learned over the course of the last 2 years in the pandemic. And all of this work is coming out of a project called Improving Services for Violence Against Children and Women. And we've had the opportunity of collaborating on this project with the American Academy of Pediatrics, or the AAP, as well as our research partner, the University of Pittsburgh. And we've been looking at the state and the intersection of intimate partner violence, child abuse and neglect, and also looking at the intersection with pediatric healthcare and community-based support agencies, and how everyone can come together in collaboration to provide quality services for survivors, again, of all ages, specifically during the pandemic, and how those services can be improved. The project goals were really focused on expanding and strengthening capacity, collaboration, and coordination of healthcare providers, child protection agencies, and other family serving organizations, including domestic violence support service agencies, to better support children and women at risk for violence and exposure to violence during the pandemic. Project partners, we were really looking at the unique needs, a lot of new needs that were brought on through the pandemic, gaps and barriers in care and access to care, and also looking at some of the critical practice and systems level changes that were necessary during this current pandemic, and also looking at ways that we can be more prepared in the event of any future public health emergency, again, to ensure that survivors always have access to equitable quality services in the event of an emergency such as this. So through this project, 3 issue briefs were developed, and they are sharing some of the lessons learned, the best practices, and some really key recommendations that IPV advocates, pediatric healthcare providers, and those working in the child welfare space, including child protective services, can implement in their programs and in the systems collectively to form stronger support networks for survivors, and ensuring that those quality services can be sustained in an emergency. The briefs were heavily inspired and informed by a really incredible study that was done by the University of Pittsburgh, which involved a series of interviews with both IPV advocates and administrators and CPS advocates to learn about the experiences and the needs of survivors, as well as survivor serving staff during the pandemic, and to learn about the new needs that were brought on and how those needs can be met during the pandemic. Through the interviews, as well as through contributions and support from the AAP stakeholder group, which we now call the National Partner Council, we heard tons of on-the-ground experiences from people who've been working tirelessly over the past couple of years with very limited support, very limited resources, and that's what we're bringing to you in these briefs. And today's conversation is to share a lot of that information, have a really robust dialogue with 3 amazing speakers here today. So we are going to have a pretty fluid panel discussion with our speakers. So I'm going to introduce the 3 of them, and then we can get started. I know Lana was able to kick us off, but we do have Lana Davis here with us today, who's the Director of Children and Youth Programs at Futures Without Violence. She brings personal experience as a survivor of violence and sexual assault, and over 30 years of demonstrated track record on behalf of survivors of intimate partner violence and their children. She has 20 years of experience at providing technical assistance to states and communities concerning gender-based violence, child abuse, and children's exposure to violence. She's been in the forefront of several national initiatives, including the Attorney General's Defending Childhood Initiative, the Green Book Initiative, and more recently, the Quality Improvement Center on Domestic Violence and Child Welfare, which is a $12 million research and capacity building project, and the Promising Futures Initiative, which is a national capacity building center for the DV field to serve families experiencing DV more holistically. She has developed and led several national institutes and training academies on subjects like trauma in schools, exposure to DV in early education, fatherhood, and DV and campus sexual assault. Thank you for being here with us, Lana. We also have Nina McConico, who is the program director for the Child Witness to Violence Project at the Boston Medical Center and the Director of Diversity, Equity, and Inclusion for the Department of Pediatrics. So she's an adjunct lecturer at Harvard University Graduate School of Education and assistant professor of pediatrics at the Boston Medical Center. She was a consultant at the Boston Defending Childhood Initiative, focused on planning and implementing citywide responses to violence. She serves as core faculty for Futures About Violence, designing and disseminating national curricula and training initiatives. In addition, she's provided numerous trainings to cross-disciplinary entities focused on the impacts of violence exposure, systemic trauma, and promoting resilience. She has expertise in working with early childhood serving systems to create and implement child-informed practices. Thank you so much for being here, Nina. And lastly, we have Melinda Cantu, who's been a part of SAFE for more than 30 years in both direct service and leadership positions, beginning as a volunteer at the Austin Rape Crisis Center and an intern at the Center for Battered Women. She has since implemented many new programs for youth and adults at SAFE. She's considered an expert in operating barrier-free shelters and services and has presented both nationally and internationally on this topic. Statewide, she's been active with the Texas Council on Family Violence, Texas Alliance of Children and Family Services, and the Texas Network of Youth Services. And locally, she's part of the Ending Community Homelessness Organization, or ECHO. And she's a part of other community groups focused on children, youth, and families as well. She has a bachelor's degree from St. Edward's University and a master's in social work from the University of Texas at Austin. She believes in the inherent capacity of people to change their lives, especially living safer lives. Her and her staff work with survivors to ensure that any violence or abuse that might be experienced does not ultimately define who they are, but makes them stronger. So thank you so much. I mean, we are so privileged to have all three of you here with us today. This is an incredibly rich lineup, if I can call it that. So thank you again for being here. I want to get started and just have you each share a little bit about yourself and what makes your work stand out in just a couple minutes each. Whoever wants to start.
Hi.
Sorry. Oh, sorry. No, go ahead, Melinda.
Nina, you.
Go ahead.
No,
you.
you.
Go ahead.
Thank you so much. First of all, I appreciate, Lana, your words today. We're reeling. The country is reeling, but so appreciate that. Just a little bit about me, more than what you just heard. Here, it's a community-based organization that's a merged organization, the Safe Alliance, that really serves survivors in all of the stages: domestic violence, sexual assault, human trafficking, and child abuse. And one of the things that really we are so very proud of is being able to collaborate and coordinate with those other stakeholders in our community and be able to really raise up voices of domestic violence survivors and their children and our families so that we can holistically really one day look to the future without violence. So truly that is my passion. It is what I have done with my life, and the people who I work with here in the Austin community. I'm so grateful, and we're very lucky that we have such good relationships with them. And I feel like that's one of the most important things that we've been able to bring. Not always easy, can be really hard, but super important.
Thank you.
Thanks. I guess I will go next. Again, just want to echo a little bit about what Melinda said in terms of just thanking Lana for her words today. And I am incredibly honored and humbled to be able to share and hold space with all of you today. I come to this work as an individual, as a woman who identifies as Black African American, who has had many experiences with inequities, kind of feeling marginalized, and kind of seeing firsthand some of those really negative impacts that can have. But also recognizing that I also have been afforded a lot of privileges, and that I carry that and I hold those with me in spaces that I come. And I will say that I guess kind of part of what makes my work unique, and kind of me within it, is that I really kind of come with that perspective of holding and uplifting kind of folks who don't necessarily get an opportunity to have their voice be heard, have their story be shared, but who without a doubt carry a lot of strength, resilience, and influence in the spaces in which they enter, and they are. And I think that I'm really fortunate that Child Witness to Violence Project, we are situated, or we are located within an academic medical institution, and so we are able to do and kind of leverage our expertise and kind of use our privilege in a lot of different ways, and so that we are able to intersect with a lot of different disciplines, providers, mostly kind of with medical providers, with child welfare system, and educators. And so I think using kind of all of those pieces again to kind of leverage what we know, and what our families have told us to be most effective and impactful and meaningful for their lives and their children. And I too, as a mom raising two Black boys, also kind of look towards and do part of this work so that we can one day, right, hopefully be in a world where they do not have to experience all of the things that we are going to be talking about today.
Oh, thank you. Thank you, Nina and Melinda. I'll be super brief. I mean, I think one of the best parts of my job is to be able to meet and know in programs like SAFE and Boston Medical Center Child Witness to Violence Project, and many others, and to be able to have the privilege of sitting in a national organization where we can learn from you all what's really happening on the ground, and be able to connect you to others, right? And to have that sort of collective impact and learning. That's, I think, the best thing that I can say. So thanks. It's always an honor to be with you.
Thank you so much to all of you for that. So we're going to move into our some of the questions that we have for you all. And again, to the audience, if you have questions that you want to bring forward, please add those in the Q&A feature. So let's talk a little bit about protective factors. So we know that when protective factors are built across the levels of the individual, relationships, communities, and society, that children, adults, and families can and will have better outcomes We also know that child welfare advocates and CPS workers do have an opportunity to support child and family health by intentionally and routinely building on protective factors and assessing for social determinants of health in order to identify what those concrete supports are that children and families are needing. So I'm going to ask Lana to speak a little bit more about this to kick us off.
Great. I could talk about protective factors all day, but I won't. So as part of the Quality Improvement Center on Domestic Violence and Child Welfare, we had the honor of working with Dr. Charlene Harper Brown, who was at the Center for the Study of Social Policy and was one of the original architects of strengthening families, for those of you who know the protective factors that focus in on the prevention of child abuse. And what we asked was, could we look through the literature to see what are protective factors that work specifically for adult and child survivors of domestic violence? Because often, as everyone here already knows, we silo our violences all over the place. And we really wanted to look at the intersection and overlap of adult intimate partner violence and child abuse. And so we were, commissioned that work, and there's lots of resources that we can share with folks. And I think, just to Jennifer's point, often we think about protective factors as individual, and these are definitely relational, but our challenge is to think about how we build environments and conditions with protective factors. We know that protective factors can mitigate the harm and risk and caused by violence. It can promote healthy development, but how can we really use them to promote conditions and experiences that our kids have, right? And so one of the things we did that I'm super proud of is we put together a video, which we're going to show you quick. This is on an individual relational. It's not on an environmental level necessarily, but hopefully you can extrapolate from that. And yeah, let's watch it.
A love letter to survivors and those living with violence or abuse. My name is Farah, and I have 3 kids. We're survivors of domestic violence. I was hurt by someone I loved, and the abuse hurt my mind, body, and spirit. My partner was so controlling that I didn't see friends or family for weeks at a time. I was so ashamed of what was happening. It made my world seem smaller and smaller until I felt completely alone. There were times when I couldn't imagine a different future. If you're constantly in survival mode, you show resilience just getting through each day, because survival is resilience. I want to share with you 5 things that help me do more than survive, to have more peace of mind, support my kids, and heal. I know that when you're trying to make it through just the next day, it's hard to believe change is possible. But taking one step to connect with others made a difference in my outlook. Even though I felt distant from my family, one day I borrowed my neighbor's phone to call my aunt when my partner was at work. Not even to tell her what was going on, but just to reconnect for a moment was incredibly powerful. It helped me see that caring relationships were possible for me. There were still times when life felt overwhelming. In those moments, I had to reach deep to access my resilience and remind myself of 2 things that I could control: how I think and how I interact with my children. The very act of telling my kids, "I love you," every day and having a morning routine helped us. I made sure my kids knew how special they were. We got stronger every day, even the more difficult ones. There were a lot of times when I had to think quickly to make sure that things didn't escalate too much when my partner was really threatening. Sometimes small changes help make things safer and more stable, like encouraging the kids to stop at the park after school so they could get energy out before dinner, or starting automatic payments for some utilities, which led to less tension and escalation when bills came in. Small things like that made a huge difference for my sense of safety. Of course, this didn't make the abuse and control go away, but each change helped me and my kids grow more and heal. Reconnecting with my aunt helped me open up to her about what was happening. And the first thing she said was, "Farah, thank you for trusting me." She didn't ask for more detail right away, but she promised to support me. Over time, her patience and support made it easier for me to communicate my needs and to show my kids healthy coping strategies. This helped us manage our world, and it helped me understand that the abuse was not my fault. I could feel that my kids and I were growing together in response to our challenges. Making conscious decisions, focusing on things that were in my control, and allowing myself to trust other people helped me learn that I am capable, and showed me that my kids and I had purpose and potential beyond what the abuse required of us. I share this part of my story with you for a reason. It's because you are capable of so much more than surviving. There are protective elements in life like caring relationships and community, nurturing and love between parents and kids, things that bring us a sense of safety and stability, the skills to understand and relate to ourselves and others, and resilience and a belief that we can grow. If we have these, we can thrive. And no matter where you are in your journey, remember that you deserve support to grow these protective factors and get closer to your own unique vision of healing and well-being.
Oh, sorry, muted. That was so well done. I think it is going to be a really powerful tool. Sorry, just trying to turn this off my screen. Okay, I think it's gonna be a really powerful tool for folks. Not only in this space, but our last webinar was for focusing on pediatric healthcare providers, for so many people who are serving children and survivors and families. It's gonna be wonderful. So Lana, I don't know if you have any last comments or remarks that you want to make before I move to a question.
Just really
Mhm.
quick. One of the things within the child welfare and DV space that's really important is that we are asking, practitioners to help promote and build, not assess whether or not people have these protective factors or not, because often we're deficit focused as opposed to, really trying to support, like, for example, social, spiritual, and cultural connections. We use support groups as that thing, but there's no reason why belonging to a church group can't be just as powerful. Excuse me. So we're asking people to sort of think there are endless possibilities about how to promote protective factors. We don't have to stay in the little boxes that we've carved out.
Mhm. Great. So to Lana's point, focusing on building and promoting protective factors, Melinda and Nina, can you provide some, just maybe one or two really concrete examples for how CPS and child welfare advocates can do this effectively? I know the video touched on a couple, so maybe you can touch on some different ones that that would be helpful for the audience.
I think very simply just asking and having a conversation with families about some of these things. And I think to Lana's point of, like, we're not assessing, right? Like you're gaining information and you're learning about this family, and trying to, right, like build upon those things that already exist for them and that are meaningful to them. Um, I often talk about, even asking for like, what does resilience mean to you and your family? And what would that look like for your children? Or what does it look like for your children? Because we oftentimes we have a very narrow um, siloed view and perspective, or even definition of how we define that and what markers we are looking for when we say resilience. But there are many different things, and so I think, again, having conversations and just asking families, right, like what does that mean to you, and what are some of those skills, or what are some of those factors that you would like to be present, right? That's going to be helpful in terms of like you and your children, right, in this moment in time, and then kind of where do you want to be in the future. So I think for me, it's a very simple, just asking and having a conversation, and kind of thinking a lot more along the lines of common humanity, if I can say it that way. Melinda.
Nina, I appreciate that you said that. It's we're all so different, every single one of us. So every single human and survivor is different, and being able to have that really honest and open listening conversation is huge. And also really important is to help people identify their strengths. People already have amazing strengths and their own resilience, and helping them really capture that as they're talking is hugely important. Just like in the video, people do many things, sometimes not even realizing, to create safety for them and their children. Over and over again, that's what I've heard from survivors and from children themselves, to be honest. So really being able to do that, and also being able to harness and utilize that information with child welfare advocates and child protective services, particularly when we here and locally have decided that peer support is the way to go. People who have lived experience, I have the staff here say, nothing about us without us. Truly, it is so important to have those voices. We center those so that we don't ever have to be in that same space that Nina talked about, to have that really slim idea of what things should be like. There are a million ways to be safe in our world.
I think the only thing that I might add to that is, so having the conversation, listening, and then accepting what the family tells you, right? So this is not about you checking the box and saying, okay, I had this conversation, and now to still proceed as usual, right? Or kind of per, this is how we do things. So we're going to put, this support in place, this parenting group, etc. But really listening, accepting, and modifying, right? A care plan, so that it actually includes those things that the family is telling you are going to be helpful to them.
Yeah, thank you so much. I really love that reframing from assessing to just having human to human conversation, almost like you would if you were talking to a friend or family member, somebody you care about, to find out what they need. What, just that simple question, how can I support you? But it's almost like, you learning how to ask the right questions or meaningful questions so you can get the information that you need. One thing that I think might be helpful for folks, we're definitely going to ask you all to share resources with people that are here with us today. But I wonder if you can add to that, like if you have questions that work really well for you to get at this, that are, I don't want to say scripted, because we want to have like natural conversations with people, But sometimes those scripted questions are helpful for people in the beginning when they're, implementing new strategies. So if you do have any, maybe you can include those or questions that you've seen other programs implement. That might be really helpful for people. Thank you. Another piece that I think really supports building on protective factors is collaborative systems of care, and being able to lean on other programs to be able to meet those needs and offer the support that's needed, right? So I want to switch gears a little bit. It's actually a nice segue into talking about our next piece around collaborative systems of care partnerships, and just collaboration in general and what that looks like and how we can all do that better. I think traditionally, not only the child welfare system, we can probably also say the healthcare system, a bunch of other service, survivor serving systems out there. We tend to work in silos and not really talk to each other, not really lean on each other for support to be able to provide expanded services for survivors. Maybe support tends to be, or services tend to be more transactional, and it's missing the trusted warm handoff to somebody that that you've connected with, what they do, how they do it. We don't want to be, handing a piece of paper, referrals or a phone number to survivors or to families when we're offering them support. So the brief talks a lot about this element of partnerships and how that can be built, starting with some really core concrete steps. But I would love if you all can talk about what that transformative collaboration looks like, particularly in the child welfare system and also for community-based organizations. And if we think about the intersection of the child welfare system, community-based IPV services, and pediatric healthcare, what could that transformative collaboration, transformative partnership, what can that look like to better serve children and families who are experiencing intimate partner violence, including the abusive partner? So I can direct this to Melinda, but anybody, whoever, you all have so much to share. So
thank you. And I'll start and just let me talk about history. You don't always start off as having really amazing and wonderful collaborations and partnerships. It takes time to build that trust and understanding, and sometimes decades. So that said, there's also really it's important bumps that you have to go through. You have to sit at the tables and go through thinking about and sharing, and I'm going to use the word cross-training, but really having deep conversations, which ultimately result in the truth that we all want. We all want safer communities and safer families and safer schools and safer homes, and that's what we want. And so how do we all get there, given the fact that so many times we are functioning in our own little small worlds, impacting humans, that they're being pulled in all of these different directions? And so of course it's going to be horrible for them and their children. It doesn't make sense to have people being pulled in all of these different directions. So thinking about who are those folks in your community that you can bring together. Certainly you identified medical, pediatric health support, interpersonal violence, and the child welfare system. Really being able to think about law enforcement, the judicial system, all of these places where people have that intersection and are pulled in these different directions, bringing those systems together so that we can have really important and tough but needed conversations so that we do things differently. The truth is that, we all know that many times our issues with racism and inequity really impact the decisions that people in power make over others. And so being able to bring that into the room and being able to talk about that and then switch that, and then having champions who use their voice. And Nina, like you said, your privilege, the privilege that we can be afforded sometimes, so that we can impact that is huge. And we're really lucky that we've been able to form pilot programs here in Travis County and build relationships for a really long time, so that what we're trying to do is have an overlay of equity as well as collaboration, consistency, and coordination, so that people aren't just pulled in completely different directions, and that ultimately families are safer and there is less harm.
Thank you. Nina and Lana, do you want to add anything to that? I'm sure you can, because there's so much that we can say on this. So just want to give you a little space if you want to add, otherwise we can continue.
Just quick, I mean, child welfare as a system is super transactional. They buy services in the community for families that are involved in the system. So real collaboration where we're sharing power, sharing resources, sharing decision making is what we really need to be striving for, and not having the same groups at every table. We talk a lot about domestic violence community organizations, but in every community, there are also culturally specific, smaller programs that have less resources. And if we were talking about transformational collaboration, we'd be shifting power and resources to those groups who are seeing families all the time, who are engaged in, in the community, and it makes such a huge difference.
Thank you, Lana. That was beautifully stated. Mm-hmm.
The only thing I would add is just putting a spotlight on the sharing resources part, or an underscore of sharing resources, and sharing resources in all of the ways that we can think of, including financial resources, and valuing people and respecting people for their time, and what they are putting and what they are giving, and kind of sharing so much about themselves and their experiences, but really valuing that in all ways.
Yes. I mean, we could take the next 15 minutes adding to this, but we have a few other really important things to talk about. So I'm going to move on, but I'll just say in the brief, and the slides will have the link to access the briefs. There are at least a handful of resources and tools available to you all to understand how to engage in partnership better, more often, more strongly, what it looks like, how to do it. So I'll just leave it at that so we can continue our conversation. So our next question is for Nina. How does your program support the survivor parent and child dyad and help nurture that relationship?
So we have a lot of different ways that we do that, and ways that looks. I will say, first and foremost, we are an organization where we provide mental health supports to families. And so we have a lot of different therapeutic modalities that we use. We have two EBTs, evidence-based treatment models that we use. And one of them kind of really focusing and honing in on thinking about the caregiver and their child as a dyad, and thinking about that relationship piece. And we don't think about them as individuals, kind of separate and disconnected from each other, because what happens to one is felt by the other, and vice versa. And so kind of very much interconnected in that way, and really kind of holding a space where both of them, right, whether you are, baby, you are toddler, preschooler, older elementary age student, but like holding a place where they can kind of express in whatever way that they do what has happened to them, get some validation around that, and to begin to get kind of a shared understanding around the collective impact. And within that, there is a lot of focus, kind of getting back to the point that I was making before around resilience and meaning making, right? And it's not just our clinicians or our clinical team kind of imposing what they believe to be true, or what they think is to be most impactful, but truly kind of having conversations and working, like to Lana's point, if I can think about it, truly partnering with a caregiver around kind of like what is the best way that we can support them. And so there is a lot of that shared kind of collaboration, meaning making that happens. We also are able to do a lot of advocacy work, or things that you know, if you were thinking of like traditional mental health services, or things that, wouldn't necessarily be reimbursable, but that is, being kind of a support person, going to a school meeting with a caregiver, thinking about ways that we can be supportive within, legal process that caregivers may find themselves in, knowing that we are not attorneys or legal experts, right? But kind of, again, thinking about how we're being kind of a supportive presence to them. And then we have been very creative in thinking, especially during the pandemic, very creative in thinking about how we can provide some concrete resources to families, recognizing that for several of them, right, kind of those levels of protection or maybe safety or opportunities that they may have had to go to, engage with an advocate or something else, weren't necessarily there during the pandemic. So finding creative ways in terms of like giving gift cards, sending care packages that are filled with things that are just going to help to support basic needs, whether it's, diapers, it's hygiene products, etc. And then again, being really flexible about the way that we are thinking about appointments and scheduling, and really trying to meet them where they're at.
Can I just follow very quickly, follow up? The pandemic did teach us sometimes people need devices and internet access and financial resources to get that. And sometimes you go to people's houses with your mask on and at a safe distance and drop it off at their door.
Yeah, that was a big lesson. Thank you for adding that. Thank you. Okay, we have about 10 minutes left and another little handful of questions. So I would love if we can get through all of them. So I'm going to keep going. Let's talk a little bit about bias and systemic racism. So we see bias in so many places in the system as it is today, in many systems as they are today, in the way that advocates and providers and support staff are, the way that we might be thinking, in policies and practices and services, in the way that programs are structured. So given what we know about implicit bias and all the ways that it shows up, and what we know about the disproportionate impacts that survivors face, how can the child welfare system address both racial and gender disparities and help promote equity across their programs, their routine practices, and also the policies? I'll open this to any and all of you.
I'll jump in. So, right, it's everywhere. And, there's child welfare policies, but there's also IPV advocates and community groups, practices and policies that we don't want to forget about us. So for example, and with mandatory reporting, as mandatory reporting is like the first lever of becoming involved in the child welfare system. On a big P front, I'm a proponent of really rethinking mandatory reporting because of how much bias is packed in to that. And it's an automatic sort of, response, whether or not domestic violence is actually part of your state statute. My guess is most people, and not all advocates are named as mandatory reporters, but many practitioners just automatically report when there's domestic violence. And I think we really need to rethink that. And the system is basically doing what it was set out to do. And so we have to change the levers of what it's set out to do. And I think, the other thing is we really need to understand what our data is. So if you're a community-based organization and you file child abuse reports, who are you filing them on? And if you don't make that explicit, and you'll never know, you'll just think we just filed because that's the policy. But if we really look at it, and some folks are using equity-driven supervision as a strategy to make sure that people aren't just making these decisions on their own, and that there's a real thought process behind it that looks at how complicated this is, because we know that if we really felt like the child welfare system was actually protecting children who are exposed to violence, in many cases, they're not even assessing what the violence, what the harm is, right? So it's just domestic violence plus children equals bad. And that is not a response that helps anybody. So I would say mandatory reporting, changing our definitions of neglect, because it's a giant catch-all, particularly for Black and brown mothers.
I'm assuming Nina and Melinda want to add, but maybe not. Do you have anything else?
I put it in the chat. It's that mandatory supporting versus mandatory reporting, and also the conversation around protective factors and really thinking through what's going to happen next. What's going to happen next? Really thinking about what is in the best interest? What's going on with, how can I be supportive? And above all else, right? Do no additional harm.
And what you're speaking to, Melinda, and you didn't use these words, but that's that self-awareness and reflective practice piece that, that is a term and a concept that is very familiar and utilized a lot within the mental health and behavioral health field, not necessarily for other disciplines. And it's not something that people necessarily feel comfortable with, but that is how you have to have the hard conversations. And that is one pathway for kind of priming yourself for getting used to having the difficult conversations, but not only about yourself and your own individual practice, and like thinking about like where are times, or how may I have been complacent, right? Like how may I have contributed to harm, whether it's intentional or not, that harm still happened. And what are you going to do differently in the future? And then as systems to really take a look and think about, right, in those questions you're asking about, like, what is our goal here? Like, what is it that we are trying to accomplish? To Lana's point, like, who are you filing on? Like, what are you filing for? And that is one way to really kind of start to check and be aware of where some of the biases may be appearing and the inequities. But it is hard work, and I think that is sometimes why organizations don't do more comprehensive kind of work as it pertains to thinking about social justice, inequities, systemic racism, because it's painful. But I think that we no longer have a choice. I think all of the things that are happening around us on a daily basis, we don't have a choice anymore.
Thank you. Thank you for that. I'm going to segue into our next question, not to like undermine the importance of this particular question and this part of the conversation. But I want to talk a little bit about centering lived experience and how to do that. I think, Melinda, I apologize. I'm probably not doing justice to the actual wording that you used a little earlier today. It was something like about us, for us, or something. What did you say?
Nothing about us without us.
Nothing about us without us. Yes. So can you talk a little bit, Melinda, about how CPS and child welfare advocates and leaders and staff can center lived experience in their programs and in their services, and just even in their conversations, just how to do that more thoughtfully?
Yes. Talking to people who've lived it, talking to families who've been involved in the system, talking to young people who have been in the system, talking to the young people who are in the system, really being able to hear those voices, lift up those voices, have them at the table when we're developing new programs, when we're talking about policies and procedures, when we're thinking about doing something new and different, really, really making sure that nothing about us is without us. Because ultimately, what we would like is for, like I said, we want people to be safe. We want to have safe communities and families, and we want people to be healthy and have what they need and be able to live and grow and do whatever they want to do and be whoever they want to be. And I'm going to say it, love whoever they want to love anywhere. So what we want is to be able to have them as part of making anything happen. And I could go on and on, because the peers who work in our organization are amazing and really can bring the house down. Sometimes burn it down, but bring it down for sure. And in terms of really being able to center their voices and make sure that we do right and cause no harm.
Thank you so much. I think this is a perfect way to close out our conversation. We are at time, so I just want to make a few closing remarks. First and foremost, I just want to thank the three of you for giving us your time and your energy and sharing your expertise with us. I think it's been invaluable, definitely to me and to our team that's been working on this with you, but to everybody that's here with us. We had a pretty large audience with us today too. So thank you so much. And I want to just share again, you all will get the slides. The links to the briefs are provided in the slides. One thing we did not get to talk about too that I just want to make mention of that is in the brief is supporting staff who are doing this work. There is a whole bunch of information in there that is really critical, especially as we're segueing out from centering lived experience. We know there's a lot of staff with lived experience that are doing this work, and the staff are dealing with a lot of the challenges that the survivors are over the course of the pandemic and beyond. So I just want to acknowledge that and point you to the information and resources that we have available on that. Again, to our speakers, if you all have any additional resources you want to share with the audience, please send those and we'll include that with the recording and put it in the archive. Thank you again all for being with us today and a part of this conversation, and for the dialogue that was going on in the chat. If you can, just take a couple more minutes to do the evaluation. We really appreciate it. Take really good care of yourselves and your spirits, and we will see you soon. Thank you.
Thank you, Jennifer.